Extreme cases of neglect, maggots growing around a dying man's feeding tube, untreated wounds leading to the amputation of a leg, and caregivers unable to recognize clear signs of sexual assault.
These are just a few examples of hospice care deficiencies uncovered in an Inspector General's investigation. The CBS 12 News I-Team combed through state records to find how facilities in our area compare. Here's Danielle Wall.
It's still hard for me to talk about.
Carrie Bergman still has nightmares about the last moments of her husband's life. Just 47 years old, Bob Browning was dying of brain cancer. Carrie chose in-home hospice care, thinking it would be the best for him to die surrounded by familiar things. Hospice set up his bed in the living room, and then everything went wrong.
No medications, no morphine, no nothing.
Bob went an entire day without painkillers, and the nurse never came at all. For 5 days, Carrie kept calling and asking for help, but by the time someone showed up, it was too late.
He's completely fallen apart to the point where I'm screaming at hospice, somebody has to do something. And that's when a nurse finally came out and said, "Oh my God," and ordered a transport instantly to take him to the inpatient unit.
Hours later, she watched her husband take his last gasping breaths.
It was horrible. What should have been my husband dying with dignity and pain-free was, I think, very painful for him and very painful for me too.
Carrie's story is all too common. The CBS 12 News I-Team found case after case like Bob's, in which hospice providers left dying patients untreated and in agony. We also examined hundreds of state and fire marshal inspections and complaint investigations for the 8 hospice facilities in our area. The I-Team counted a total of 241 code deficiencies over the past 10 years. The most common issue is what patients are not getting, like no nursing care, medications, or medical equipment. In one case, a family gathered at their loved one's bedside to be there as they turned off life support, but the nurse never showed. In this report, the doctor's explicit orders were ignored. In this one, bereavement services were dropped. And in yet another case, a patient waited so long to get his pain medication, he ended up back in the hospital. Our findings were almost identical to the cases highlighted in this Inspector General report on hospice facilities across the country. It found hospices do not always provide services and sometimes provide poor quality care, like leaving patients in pain for days. Assistant U.S. Inspector General Aaron Bliss.
Our reports shed light on just how common it is for hospice providers to be cited with deficiencies in their quality of care, and sometimes serious ones.
And the fact that these people happen to have a terminal diagnosis, maybe cancer, maybe some sort of cardiac condition, that doesn't excuse the hospice or nursing home to neglect or abuse that person.
Attorney Michael Brevda believes the Department of Children and Families, which investigates hospice care in Florida, doesn't have enough investigators to look into complaints. And in his experience, once a patient dies, those investigations stop. Problematic in a business providing end-of-life care for the terminally ill.
So you have to really process that and think about what a terrible system we have in place where if the harm is so bad that the victim dies, well, we're just going to stop investigating right there. That's a broken investigation system, in my opinion. But
DCF told us in a statement the investigation can continue following the death of the alleged victim.
Any service failure is too many. But they really are anomalies. They don't occur that often.
Paul Ledford, the head of the Florida Hospice and Palliative Care Association, says no family should ever experience the kind of service failures detailed in the Inspector General's report. But he adds that when you consider the amount of patients they serve, the number is very small.
They did a report on the state of hospice in this country, and they picked some sort of extreme cases to explore. We don't think that reflects hospice in any way.
This is the first time that we have taken a comprehensive look at patient safety and quality in this way.
The government says 87% of hospice facilities had at least one deficiency. About 1 in 5 were serious. But unlike nursing homes and hospitals, hospice care doesn't have to report client complaints. Now the Inspector General's office is calling for a system-wide reform, including requiring all complaints to be reported to the government and, where appropriate, law enforcement.
It's critically important that Medicare has a full picture of patient harm so that it can accurately and appropriately respond.
Bliss says they're just getting started.
There are a number of actions in progress, and some of these will be ongoing activities, not a one and done.
Changes that could save others from having to endure what Carrie and Bob went through.
I have always been led to believe that hospice let people die with dignity and to be pain-free, and he had neither. Neither.
If you are having hospice issues, you can report them to the state's elder abuse hotline. That number is 1-800-96-ABUSE. Danielle Waugh, CBS 12 News.